A patient came into my clinic last week. Let's call him Aman. He didn't come in for a consultation. He came in with a folder full of MRI reports and a date already set for surgery at another hospital. He had a disc bulge at L4, L5 and some radiating leg pain. He was told the disc is hitting the nerve and we had to cut it out. He was nervous, scared, and he wanted a second opinion before he went under the knife. After looking at his reports and more importantly, performing a physical examination, I told him something he didn't expect. You don't need a surgery, not today and hopefully never. Hi, I'm Dr. Jayesh Bhanushali, a spine surgeon, and let's get into it. Why would I turn down a surgical case? Because Aman was a victim of a common mistake, treating the scan and not the person. If you look at an MRI of 100 people on the street with zero back pain, about 30 of them will have bulging discs, a bulge-like wrinkle. A bulge is like a wrinkle on the skin, and it's often just a sign of aging. In Aman's case, his pain wasn't coming from that bulge on the screen, it was coming from the inflammation and mechanical instability. His spine wasn't broken, it was just inflamed. If I had operated on that disc, I would have given him a scar and a bill, but his pain likely would have stayed exactly the same. We call this failed back surgery syndrome. It happens when you fix a finding on a report that wasn't actually the cause of his pain. Here's what we did for Aman instead of surgery, and these are the 3 things you should look at if you've been told you need a procedure. Number 1 is medicine management. Pain is often about chemistry, so we use targeted anti-inflammatories, specific lifestyle changes to treat the inflammation around the nerve. If the nerve isn't inflamed, it doesn't matter. If the disc is touching it, it won't hurt. Second, physical therapy. We sent Aman to a specialized physical therapist, not for stretches, but to wake up the deep core muscles. These muscles act like living back brace. When they turn on, they lift the pressure off the spine naturally. Third, positional decompression. We taught Aman how to move and sit in the way that opens up the hallways in his spine. Aman is now 4 weeks into the recovery. His leg pain is about 80% gone. He never had to step a foot in an operating room. The lesson here is simple. An MRI is a diagnostic tool, but it's not the whole story. Surgery should always be the final door you walk through, not the first. If you've been told you need a surgery, ask your doctor, get a second opinion, fix the lifestyle, fix the mechanics, and the back will often fix itself. That's all for today. I am Jayesh Bhanushali, your spine surgeon, signing off, and I'll see you in the next one.